the last few years, the pitch for healthcare AI was very simple. It will save you money, less admin work, fewer errors, and lower costs. That was the whole story. That story just changed, and it changed on both sides of the table. The hospital is buying AI, and the investors funding it. So this shift, what we are seeing today, defines is how you pitch as well. I'm Deepti, and this is IDA Hub AI in Healthcare podcast today. So today there are two conversations happening right now in healthcare AI. One inside the health system as buyers, and one inside a venture capital who are actually funding startups. And those are all pointing to an exact same shift. So let's talk about that. For years, health systems have been flooded with AI vendors pitching solutions, which would say, buy a tool and hope it sticks on the money. And on the money side, healthcare AI has mostly been sold as a cost cutting story, the same way every healthcare tech wave before it was sold. There are two new pieces from MedCity News and also a recent discussion in a HIMSS conference that point out that these assumptions are breaking down at the same time. So let's start with the buyers, the buyer side from inbound pitches to data-driven projects. Michael Musi is CEO of Arcadia, a health data platform, and he made a point recently at a HIMSS that I think reframes the whole AI buying conversation. His argument is health systems should stop responding to vendor pitches and start with their own data instead. Find the inefficiency first, then go looking for the tool that fixes it, not the other way around. He put it this way, and I'm framing it here. Instead of an inbound sales motion, it becomes a data-driven project. You look at your own numbers and you find where the clinical variation is. You estimate what closing that gap is actually worth, and then you go shopping for vendors. That's a real shift in posture. It puts the health system in control of the ROI conversation instead of the vendor. Now, here's a part I think matters even more. What counts as ROI is getting redefined with AI. The old model was narrow. Did this tool increase visit volume? Did it cut specific cost line? But Michael's point is that a lot of AI tools generate real value that doesn't show up as clean financial number from a healthcare perspective. Reduce administrative burden, better physician satisfaction leads to better retention. And retention is not a soft metric. Replacing physician costs a health system documentation tool, something like reduces burnout, and even a handful of physicians stops them from leaving. That's a real, very large number. It just doesn't show up on the same line item as reduced billing errors. Michael actually compared this to the tech industry's idea of developer experience, giving engineers the tools to work efficiently. So when you compare that with the healthcare systems, he said, are starting to think about physician experience as the same way. So that's giving tools to physicians is what we need to think about. He mentioned a CFO at a large Massachusetts health system who now has a formal work group asking, what ambient tools do we have? What computer-assisted coding tools do we have? How do we cut administrative load on our clinicians? So that's a CFO thinking about burnout tools as a retention strategy, and that's very new. One more piece from this article worth stating here is switching costs. Switching costs of vendors are dropping. As interoperability improves, open APIs, standardized data formats, health systems aren't locked into AI vendor anymore. They can pilot a tool, measure it, and if it doesn't deliver, replace it without ripping out the whole stack. So that changes the buying behavior too. Lower switching costs mean more experimentation, faster adoption of whatever's actually working and less patience for vendors who can't prove their numbers. So that's the buy side. More discipline now because you start with the data and measuring value a lot more broadly than just thinking of cost cutting or the invoice. So, what's this transition? Now, think about the other side of the table. Not, I'm not talking about the vendors selling these tools, but the investors deciding which of the vendors are even worth funding in the first place. And the story coming out of the investor community and the recent news is genuinely a different one we have heard in the past for the healthcare cycles. The investor's perspective from cost cutting to cash flow is what we are seeing. This month, MedCity News ran a panel from their Bullseye event in Chicago. Four healthcare investors, moderated by David of Wyndham Capital Partners, talking about where AI fits in the history of healthcare tech waves. The panel, Joe Natori of NVIDIA Capital Management, Carter Prince of CVS Health Ventures, Amy Raimundo of Kaiser Permanente Ventures, and Shubhra Jain, Chief Business Officer at Hippocratic AI. Their core argument, healthcare has been through a big tech-driven investment wave before. The dot-com era, the genomics boom when DNA sequencing took off. These waves were sold on efficiency and cost savings. This wave is different, they argued, because AI is the first one that's actually proving it can generate new revenue, not just cut costs. And some of the return figures cited on the panel were very striking. Investors are pointing to returns as high as 100x on certain AI investments in healthcare. A couple of specifics from that panel are worth sharing here. Amy Raimundo, managing director at Kaiser Permanente, said this kind of ROI potential is exactly what's speeding up AI adoption across the industry. I think the bigger the ROI, the faster people move, she said. And when the value is more subtle, it turns into a much longer adoption cycle instead. That's a pretty clean explanation for some AI tools to get adopted in months and others sit in pilot for years. Raimundo also made a bigger structural point that this is changing what health systems are even willing to attempt in the first place. Her framing, there's a whole category of projects that never get greenlit before simply because of the marginal cost of pursuing them was too high compared to the payoff in terms of ROI. She thinks AI is actively rewriting that math, making previously unprofitable ideas worth doing here. And Carter Prince from CVS Health Ventures added a market expansion angle. Because AI tools are generally easier to adopt than earlier generations of health IT, smaller practices are also interested, and those who had never invested in kind of technology before are buying in. That's not just existing customers spending more, that's a wider customer base entirely. So, from the investor side, the picture is very big. There's a clearer ROI that moves faster. AI is making previously unprofitable projects worth pursuing, and the addressable market is growing because adoption is easier than it used to be. So, what this means for if you're somebody within a health system evaluating, what do you actually do with this, what we talked about, right? If you're sitting inside a health plan evaluating AI vendors, so if you're listening to this, the first thing is borrow Michael Macy's discipline. Before you take a single vendor meeting or talk to vendors, go find your own inefficiency first. Know your number before someone else tries to sell you theirs. Second, widen your definition of ROI on purpose. Here, if your evaluating framework only has room for hard dollar savings, you're going to systematically undervalue tools that reduce burnout, improve retention, or make your best people, that's the clinicians who want to stay. Put a number on this retention. It's not soft, it's roughly $1 million ahead. Third, notice what Raimundo said about speed. If you're struggling to get an AI project approved internally, ask honestly whether the ROI story you're telling is a big and obvious or subtle and hard to see. You, or it needs a different pitch internally than, hey, this saves us money for next quarter. And four, this one is for anyone building or selling AI into healthcare, not just buying it. A few real numbers are worth studying if you're trying to pitch ROI well right now. So operational ROI, faster documentation, faster prior art, better scheduling is table stakes at this point. Premier's health team, research team put it well. Those wins are real, but they are no longer the differentiator. The next year is showing you can move the outcomes and quality at scale, not just save time. Second, lead with one real number, not a category level promise. Like Mount Sinai recently talked about internally building a malnutrition detection tool, which generated roughly 20 million in revenue, which could impact. I mean, the impact could be seen through early detection and intervention, one specific tool and one specific outcome. CommonSpirit automated its cancer screening adherence workflow and saw a five-fold increase in care gap orders, which can show a buyer their own version of one of these numbers, not just an industry average. And these are the kind of projects that are getting funded and getting renewed. Third, show the whole downstream chain, not just the point solution. The 100x return we mentioned earlier from the Hippocratic AI panel wasn't from the AI call itself. It came from getting patients back in for a follow up, actually generated the revenue. If you're pitching a healthcare AI, be able to walk the buyer all the way from here's what the tool does to here's the revenue, 3 steps downstream, not just the first step. And four, fix the operational problem first and then bring the AI. Don't lead with the AI tool. One practice actually cut its no-show rate by fixing scheduling and workflow problems first and then layering AI on top of the process. That ordering matters to buyers who have been burned by tools bolted into broken workflows. The 100x stories are going to keep coming, and some of them will even be true. But the underlying lesson from all of this is AI just doesn't help you make money. It's that the winners, buyers, investors, and vendors alike are the ones treating ROI as something you measure specifically and rigorously, not something you assume here. So we talked about two articles, two audiences, the investors and the health systems or health payer and the payers. One shift healthcare AI is moving from is not just trust the pitch to prove your number on both sides of the transaction. If you're evaluating AI right now, I'd love to hear what your ROI framework looks like. I will have the link to MedCity News and what we talked about in the show notes. So thank you for listening. That's it for today's episode of IDA Hub AI in Healthcare. I'm Deepthi, your host. Thanks for listening. Please follow our channel and also let us know your feedback. Thank you. See you next time.